Among all the infectious diseases in the developing world, malaria is the deadliest, striking nearly 200 million people and killing 500,000 each year, especially children in Africa.
Malaria is one of the largest childhood killers. Even when we have appropriate treatment and diagnostic methods.
Spread by mosquitoes, the malaria parasite has repeatedly developed resistance to a succession of preventive drugs, and controlling this disease remains a major challenge.
Kills a lot of people every year. For the past decade, there's a consensus to try to eliminate the disease, eradicating the disease from the globe.
In some areas of Asia, local authorities have had promising success in reducing malaria infection. And in northwest Indonesia, a region that was devastated by the tsunami in 2004, a model pilot project has shown that malaria can not only be controlled, but can actually be eliminated.
Banda Aceh has been a malaria endemic area for a long time. Our data from before the tsunami in 2004 shows that every year, 1 in 10 people in Sabang Island would have been infected with malaria. Many of these cases would have died, particularly children. My name is Robin Nandi. I head the health programs at UNICEF Indonesia. We will all remember the tsunami in 2004. There was a massive emergency response. One of the major health responses to the tsunami was a malaria control response. The government of Indonesia, supported by UNICEF, used the opportunity provided by the tsunami response to completely reshape the way they ran the malaria control program.
We were worried that the tsunami brought lots of seawater inland, creating many lagoons of brackish water, which are the breeding sites of Anopheles sundaicus, which is a particular type of mosquito endemic to Southeast Asia. My name is Bill Hawley. I work for the Centers for Disease Control, and I worked with UNICEF in Indonesia after the tsunami to figure out how to eliminate malaria. The most common symptom of malaria is fever, chills, shivering, and shaking. And if it's promptly treated, it can be cured. If it's not promptly treated, you can die. So we work to control malaria using standard measures. Diagnosis, treatment, mosquito nets. We succeeded. There were no malaria outbreaks in Aceh post-tsunami.
This is the whole province of Aceh?
Because Aceh is located on the very tip of Sumatra, island-like, we thought we would move towards elimination, reducing the disease so there's no longer any indigenous transmission. The Ministry of Health, with the local government of Aceh, working with UNICEF, succeeded in eliminating the disease from Sabang, which now serves as a model for other parts of Indonesia, and indeed for other parts of Southeast Asia.
Sabang is an island just off the mainland. It's only 45 minutes by ferry. This island receives almost 1 million tourists. That makes the challenge of keeping malaria case on the zero level even more difficult. My name is Kinanti Pinta. I am with UNICEF Indonesia. I came to Sabang to check the progress in malaria elimination. Ayo, Pak. My first stop, the district health center. This is the lab where health workers check blood samples from patients with fevers. If the blood sample is positive, then they will give the information back to the health center so that the patient will receive the right treatment. Sebelum 2004? Oh, dikasih.
Iya, untuk
They are building a new lab that will become the malaria center for the island. Because it shows government commitment to keep malaria case on zero level.
The males are expendable. Malaria is a parasitic disease that is spread by the bite of Anopheles mosquitoes, which bite at night. The mosquito is infected with the parasite, and it spreads from mosquito to human, and from human to mosquito. So it's a cycle. The key to malaria elimination is to track every individual who is infected with malaria. And this is done by village volunteers who live in the community and report to the health authorities that people may have malaria. It's done by ensuring that the hospitals also report cases, so that we go to the field, follow up cases, and we kill the parasite with drugs before a mosquito gets infected. To break the chain of transmission, we're trying to protect mosquitoes from being infected. And for malaria elimination, you want to prevent transmission altogether.
This is Ibu Sri Kayanti. She is a malaria volunteer. She goes around the village on a daily basis to take blood samples and also to educate about malaria treatment and malaria prevention. And because of her job, she is known here as the vampire lady. Di sini, Bu ya?
Iya, ada. Awalnya kami diberi pelatihan dulu tahun 2010 ya.
I started the training to be a malaria volunteer in 2010. I love this kind of work. In 1987, after giving birth to my 5th child, I contracted malaria myself. A few days later, my baby contracted malaria. And there was nobody to help me. And there was a myth that if you had malaria, then you shouldn't eat banana, papaya, sticky rice, coconut water. I worked to tell the people that it was only a myth. So now if you have malaria, you go to the hospital. And if somebody is confirmed to be positive for malaria, she says that everyone within 200 meters radius has to be tested as well. There is very rare malaria cases now in my village. More and more children are growing up healthy.
Ini kan rumah ini cantik, bunganya banyak karena ada anak gadisnya 2.
Oh, she said that this house is beautiful, full of flowers, because there are 2 young girls in the house. She comes here once a month for a house visit and takes her blood sample. This is Ibu Nurmala. She thinks the reason why she or her family never had malaria was because of the routine inspection that has been done over the years. In her early years living here, malaria was a common thing. Like everybody got it. It's gone now. And she said thank you to everyone, including to the volunteer. After the volunteer gets the blood sample, she'll bring it to the health center. And in this case, the blood sample test came out negative. Ada yang punya gitu. The population of this island is roughly 28,000 people. Most of them make a living as fishermen. The rest earn their living to support tourism industry. I met with the mayor of Sabang, Mr. Zulkifli Adam. He suffered from malaria when he was still very young. So he knows personally how it feels to be infected with malaria.
Peningkatan hilangnya malaria yang ada di Sabang.
He is very happy now that malaria has been eliminated in Sabang because it had affected thousands of people. There have been a few cases of malaria recently, but after we did investigation, it did not come from Sabang. This is Lasmi. She is 7 years old and has been tested positive for malaria. She has had a fever for a week now, and she said she is still feeling nauseous and still has a severe headache. She has been on malaria medication for 2 days. And today, the health worker will take her blood sample once more to be analyzed. When she was tested positive, they took blood samples of everybody within the 200 meters radius. Lasmi's case is the 3rd malaria case in Sabang in 2015. So this is the back of the house, and the health officers here are looking at any signs of larvae.
Sepertinya tidak ada.
There is larva in the water, but it is not an Anopheles larva. Anopheles is the malaria carrier. They are going to take a sample to the lab and find out exactly what type of mosquito it is.
And then we were surprised that we had some malaria cases. And we found, my goodness, it's a strain of malaria that circulates primarily in macaques. But every once in a while, an infected mosquito will bite a human and infect the human. The folks who are at risk are those who are close to the forest where there are monkeys. Mosquitoes don't travel very far. The important question is how far do people travel? Because this disease moves around in the blood of humans, and people travel a long way.
The government here has a plan to put a thermal body scanner at the port. It will be able to indicate people with high fever, and those people will have to undergo blood check. The problem is not only from the tourists, but also from locals. For example, mining workers. So they leave the island in a healthy condition, but once they are at the site, they may catch malaria from other miners and bring it back home to Sabang.
I believe that we can eliminate malaria from Aceh Jaya. When I came here, the number of cases malaria is 1,364. Now we have 125. I am Suwarni. I am the head district health office in Aceh Jaya, Indonesia.
Suwarni was the head of district health office in Sabang Island when malaria was eliminated. And now she has the same position in Aceh Jaya district.
And Aceh Jaya is an area bigger than Sabang. Also, the demography in Sabang quite different. For example, in Aceh Jaya, we have the mountain we call Gunung Ujen. This is the place for people to find the gold. This is also one of the reasons about the malaria in Aceh Jaya district.
We're on our way into the mountain in Aceh Jaya, where migrant workers are searching for gold. The malaria situation is very serious here. There are lots of mosquitoes. We are only halfway to the gold mine. This is a very difficult and challenging journey. The other two cars couldn't make it up here. So this is what health workers have to go through at least once a month to check on the miners.
100 meter more.
We're going to make it. Let's go.
Slow but sure.
We are walking to the gold mine, and we have just been given permission to go there because not everyone is allowed to go. This is the worst condition he has ever experienced. His family gets very worried whenever he's up there. He had the malaria when he was at the mine site. He went back home to get treatment because malaria does not heal by itself. The miners live in the forest in a very rough condition. If the miners contract malaria, when they go back home, they would take the parasites with them and spread the disease. The health workers do a monthly checkup on the miners to see how they are doing and take blood samples on those who have fever and give medical advice and provide them with medicines.
This is one of the hall in the mining area. Some of the water also here as the place for the malaria. You can see the larva there. So this is the place for the breeding place of the larva of malaria.
The miners say they are aware of the dangers of having open water, which can be breeding site for mosquitoes. We find a lot of possible breeding sites all around the campsite.
Yeah. Mr. Abdullah said they have malaria problem. The family worry they have malaria here. He have malaria 4 months ago. I asked, do they have the mosquito net here? Said yes, they have. Mana lagi yang sambungan? This is the mosquito net we give from the health office in Aceh Jaya. Because we can see here, some is broken. Please go to the community health center to change the mosquito net for you.
Ada kesempatan besok, ya besok bisa.
He will come tomorrow.
Karena malaria itu memang udah sering terjadi di sini.
This is Samsul. He said that his colleagues take health matters very seriously. He has to stay healthy because this is his bread and butter. If he is sick, he wouldn't be able to work and earn money. Anyone who's diagnosed with malaria in Aceh Jaya usually winds up in this health center.
This patient got malaria. He's working also as gold miner. He has been working there for 2 months. But after 2 months, he got the people 5 days ago.
The head of the health office in Aceh Jaya has a huge challenge to achieve here what she did in Sabang.
Malaria is eliminated in Sabang. What it tells us is that if we can eliminate malaria in a place like Sabang, we can do it elsewhere as well. However, the battle is far from over.
The case of this 7-year-old girl in Sabang shows us how important it is to maintain surveillance to prevent malaria from coming back here.